welcome everyone. Today we have our another new episode. This episode is very important because every day we get calls from different corporations, different developing nations, because they love to learn more about how they can improve their healthcare system. And ICT is very important, information and communication technologies, and we have to apply this kind of process. And I believe that we have our world famous speaker, Professor Rob, Professor Donald, uh, uh, Mr. Dan, and Mr. Nicholas will discuss on that particular point. And most important thing is that there are many corporations now, they want to invest in healthcare system, because it's actually a massive problem right now in developing nations. Country like India, Bangladesh, Indonesia, Vietnam, everybody suffering. So I believe that our honorable speaker can guide us to our audience. So I want to start from Professor Rob. How do you want to analyze today's topic and how we can improve this area?
Sure. Okay, starting off with, since we're talking about healthcare, healthcare has three unique, we shouldn't say totally unique, but three problems that constantly struggles with. One is the equipment is very sensitive to interference, which makes it very hard to connect a lot of the devices together using wireless technology, because the wireless technology can make the equipment less accurate. Also, like every company or industry, it has an issue in terms of the equipment being very expensive and very hard to keep up to date. Next area is security. That's really come forward over the last couple decades. The regulations that surround the healthcare industry make it absolutely critical the information is secured. Healthcare institutions have been attacked by ransomware and malware over the years, and their exposure, of course, is very high. And if they're breached, and a hacker does harm, it is one of the industries where the breach could almost cause immediate death or serious problems because of the nature of the equipment that's being breached. And then third, and this came up in spades during the pandemic, data access has become a huge problem for the industry. It's actually at cross purposes to security. Many of these systems use different standards. They are not designed to talk to each other. The databases are from different ages, different vendors, and it makes it very hard for the industry to research things like medications for pandemics and viruses. They have massive amounts of information, but you can't access it. In fact, one of the sad things that happened this last year is IBM, which was one of the leaders in trying to institute artificial intelligence for healthcare, decided to start backing away from that industry, which I think is unfortunate. Three technologies that are being focused on trying to help healthcare. I mentioned artificial intelligence. The great hope here was because doctors only can carry so much knowledge, and because specialties are required for so many illnesses, and because the treatment must follow the diagnosis, that AI could do a tremendous job of pulling together the world's knowledge and providing advice. I was part of the early trials with Watson and medicine, and one of the stories that was told at the time was one of the lead doctors had spent years trying to diagnose an illness for a woman that was under extreme pain and nobody could figure out what it was. After years, he finally figured out what it was, and she was put on a treatment that made her within a few weeks able to function in society again. After being trained, Watson identified that same illness and treatment within 14 minutes of being fed the same diagnostic information. So it showed that the promise of the technology is still very great. Number two is federated learning, being able to look at data without invasively going in to the data sets. So you abstract the data so that the individual's information is protected, but you still get the benefit of the data so that you can analyze it. Federated learning is believed to be kind of the biggest fix for our data sharing problem, and the hope is that that federated data will data approach, federated learning approach, will be able to solve the problem we had with regard to data access. And then finally, as we move into an IoT world, this idea of being able to place sensors on everybody that can feed real-time information into the healthcare organization, both so they can track things like pandemics and apply remediation where it's most needed, and also to identify when a person's sick really early on, much like trying to catch a fire. If you can catch an awful lot of illnesses like pancreatic cancer that is largely deadly early enough, you can increase the survivability of the disease, and if you can instrument the body much more effectively, then the medical institution can respond more forcefully and more timely to the illness. And the hope is we'll have more cured people and far less people on medical death row.
Thank you, Professor Rob. Professor Donald, how do you want to analyze your organization actually help in different developing nations? And developing nations face a lot of challenges, especially for healthcare system. And how do you want to analyze what the solution you have in your hand?
Sharif, I think you mean me. Yeah, I really believe that ICT has a great role to play in healthcare globally, because the sharing of information, as Rob said, is so important. And in fact, in the United States, there's part of every EHR that is applied. It's called Break the Glass, that in time of a disaster or pandemics, there's a defined process to lower the HIPAA standards to be able to let more people access it. And so those are some of the type of things that really begin to go into what we're doing, though. But, today the world has become much more sophisticated world all the way around it. And Rob is 100% right that security and the other things, the federated learning is a really important part of it. But so is how you begin to look at how do you reduce the communications gap that's required for ICT? Because ICT goes all the way to the patient, all the way to the payer, all the way to the different types of providers, and to the devices, as Rob said. So it's a very broad ecosystem that's used there. And what's kind of interesting is if you sit down and look inside healthcare, uh, traditionally in healthcare, um, the cost of healthcare really outpaces GDP growth in almost every country. So you see it going up and up, and well, going forward though. But what's interesting is when you look inside, and for example, a hospital, personnel costs account for about 70% of a hospital's budget, and ICT costs are down to somewhere between 1 to 3% of their budget. So even though it's in there, it's the technology's being used, it's still a small part of the budget, and the users using it, even though they're technology savvy with the equipment and even with their smartphones and other things, there's still a disconnect between using, particularly on patient information systems in the EHR. I can tell you some of the hospitals and clinics we've worked with, a patient encounter might be 10 minutes of a doctor's time, and it takes them 15 minutes to fill out the records after that 10-minute encounter. So there's this cost barrier of working with the system. And in many times, the ICT systems do not really have an ROI other than being able to document the encounter better, being able to interface and collect the records. But it's a changing role in that area. Rob talked about federated education. One of the other things I'd like to queue up earlier, when you look at the ICT components of the healthcare system, is we also need to federate the databases, the data recording things that are getting the data from all these devices. For many, the classic database is a SQL database, a relational database. That's important as we begin to do more AI, more data science. The use of different types of NoSQL databases goes up. One of the types of databases I have found very, very useful in healthcare is something called a time series database that actually records data with its time reference to the month, day, hour, minute, second, so that you can see how things progress over time within a database without having to do a lot of extra entry. And there's another type of database that I'm seeing increasingly used in particularly the big data science part of healthcare called a graph database. And it's kind of a 3D type of approach to databases, kind of like the Matrix you saw in the movie The Matrix, which allows you to do some of the type of quick analysis like Rob was talking about. I too was sad to see Watson pull back, but I can tell you I was involved with one of the Watson trials at MD Anderson, and they struggled with Watson there because of how it ingested the information. And the proper data is necessary for any ICT system in healthcare. Your decision you can make is only as good as the data you have access to. And so, particularly as you look at developing and deploying these, you have to really spend a lot of time understanding it. The other thing, particularly in developing nations, is the ICT components of healthcare and the different repositories and EHRs, HISs, other parts of it, in many ways help us lessen the rural divide to the cities divide. Yes, if I'm sick, it still takes me time to get to a hospital if I need to get to the hospital. But with telemedicine, telehealth, telemental health, electronic prescription dispensing, remote radiologies and stuff, that gap is getting smaller all the time. And really, the growth of ICT is a leading indicator of that. I was on the team at Johns Hopkins as a consultant when they did their first robotic surgery from Baltimore, Maryland to Singapore. And it took 3 DS3 lines to handle the communications on that today. Well, we can do that easily with the technologies we have deployed in many parts of the world today. So technologies helped us do a dramatic, broader view of healthcare. Last comment on this first part is the use of ICT in healthcare for the average consumer is very interesting. Yes, I now have watches that will take my vitals, it will take others. I can add things to my smartphone to measure many more type of almost medical devices. But one of the things that doctors find interesting and frustrating is that when we get sick today, we do internet searches to figure out why we're sick. And then we go to the doctors and tell them, here's the disease I've diagnosed myself with. And most of the time, it is not accurate. But yet we've prescribed it, we've got ourselves worked up on it. We might have even begun to take some non-prescription medicine to deal with it. But that has also made the doctors, though, have to stay up to date more. So it's a double-edged sword there. So there's a lot of things we can talk about in this particular area, but I think that's a good first step.
Mm-hmm. Thank you, Professor. Mr. Dan.
Okay, let me unmute here. Yeah, boy, what a big topic, medicine. Of course, ICT is involved in everything these days, so nowadays ICT is in medicine. You have to, from so kind of taking kind of a transhumanist candidate perspective, because I really love their party platform on health and medical issues. You have to give people the freedom to make their own health decisions. And, the government, mostly, if you talk to them about gerontology, they will say, well, we need to spend money on like better rubber sheets for old people's homes and, they're not into this idea of indefinite longevity or longevity escape velocity. I mean, this is probably a scary thought because it would potentially bankrupt the retirement pension system. So if you want to extend your life, don't necessarily look to the government or the medical establishment to do that. But that's where the incredible wealth of information online can be a help. But there's a lot of bogus information online too. So you really have to educate yourself very astutely to filter out the truth from the non-truth online. I know a lot of people with alternative health views are being deplatformed from the internet, and that's a touchy area. That would be a whole other topic about free speech in the information universe. But you have to look at the motivations. Okay, government doesn't want to pay out benefits to people who are living to be 200, so they're not going to support that. Doctors aren't going to necessarily dispense the lowest cost cures. In fact, the American Medical Association actually has a patent on the word cure. If you use the word cure, you could be dragged into court for using that word. And indeed, the medical establishment in the early part of the 20th century, they basically went around, in the US at least, and de-credentialized every medical college or educational system that wasn't teaching what's called allopathic medicine, which if you look, allopathic view of medicine is basically you suppress whatever symptoms are going on, usually with pharmaceuticals. And it's probably no coincidence that Andrew Carnegie and the big petrochemical interests, which most of the pharmaceuticals actually derive from petrochemical feedstocks, it was a nice little hand-in-glove arrangement because, oh boy, we've got rid of all the homeopaths and all the complementary therapy. And they did this under the guise of streamlining the education of medicine. But as a consequence, I mean, if you look up, the second leading cause of death is what's called iatrogenic fatalities. This means doctor-caused fatalities, and I think it's over 100,000 in a year in the U.S. That are iatrogenic casualties. And there's even evidence that shows when doctors go on strike, the death rate has gone down. So there is a problem of being over-medicated, and people need to take more responsibility. Responsibility for their healthcare decisions. So I think that's my opening salvo on the topic. And by the way, if you anonymize medical data, HIPAA, by the way, stands for the Health Insurance Privacy Act, I believe, and that's why we can't share a lot of medical data. But there was a recent transhumanist salon where he said if we did have access to at least the anonymized data, we could do great research based on these data sets. But right now, those data sets are not available because of privacy issues. So lots of things to work on the medical front. Think for yourself and stay informed.
Thank you, Mr. Nicholas.
So much. We have technology, we have doctors, we have healthcare, health insurance. There's so much. I'm from the USA as well, and it's just a big triangle of money making. The hospital needs to make a profit, the insurance companies need to make their profit, and the pharmaceutical companies, and to take something away from one person, they have to take it back from another person, and the triangle just goes around and around. So beyond the technology, we need a restructuring of costs and where money comes from for healthcare as well. And I know Americans are against the idea of universal healthcare, but I've been living in China, and they have an option to opt in or opt out of their Social Security, which is also their medical security. And it's such a big system where even you can take out loans against your Social Security or use it in the hospital if you want. You know, you don't have to, or you could just wait till retirement to use it. You know, a bigger social system like this would actually help a lot of those cost issues. And another thing is with their information here in China, it's all digitized. You know, you go to a hospital, you get a card for that hospital, and all your information is relative to that card and your serial number, and it gets nationalized. It's not anonymous, and this way they can really do better at figuring out like what isn't a national pandemic much faster, or issues or cures, research. I can't say cures, I'll get in trouble, but more research on medicines. Another aspect that's unique here is how they do collect data. For example, Huawei, there's no secret here that they track everyone's data with their phones. If you go into Huawei headquarters, it shows you where all their phones are located. And that information is open source. If you're a university student and you want to use that information for a paper or thesis, you're allowed to use it. It's your right as a Chinese citizen. But now we go over to the USA and they want to use big data. They can't, unless it's already 3 or 5 years old. The only way you have access to immediate or recent big data is by paying for it. So only corporations can afford that. So just like how medical systems could be improved is kind of this system, but this takes away a lot of privacy. And that's something Americans and a lot of Westerners really want to believe that they have already. But by keeping it, or by believing you have it, you're slowing down progress, because you're not the only one with this issue. And the fact is that the more we learn from your issues, the faster we can treat other people. And yeah, so the technology can get better if people are willing to opt into systems where they're either data is anonymous or public, to help others. At least have an option to opt into it. As far as technology goes and how that can improve, I just think it should be more open source, and even maybe some bilateral agreements with other countries, trading and selling their health and history and their data with each other more, you know, for whatever they can do. Another problem with third world countries I've noticed is that the medical professionals leave to go to higher paying nations. And I think those nations should incentivize the doctors to stay, perhaps with bonds or other ways to, the more they do, the more money they'll make back as a professional. Yeah, I try to touch a little bit of everything.
Thank you. Professor Rob, there are two critical problems we are facing right now, especially when we connected with different countries, at least in Asia and Africa. Two specific problems we have. Number one, we have shortage of doctor and nurses.
Yes.
So, yeah, shortage of doctor and nurses. Even in Malaysia or Bangladesh, even in India, everybody has this problem. How we can solve this problem, like with the help of ICTs and this kind of thing. This is number one. Number two, there are doctors and patients, but patients actually do not get enough support from the doctors. Even many support doctors trying to utilizing Zoom and this kind of things for providing services to the patients.
Yeah.
But is there any advanced technology to solve this problem? These are the two massive problems actually happening right now. Vaccine is a different issue. Maybe we will discuss in another session. But these two problems, how we can solve through ICT?
Well, vaccine is a distribution issue. The technologies that are being applied already in a lot of these geographies are telemedicine, remote sensor sets, the work with the Neopina natal monitors, where they were able to develop a prenatal or a natal monitor that I think costs about $3.50 a unit, and it competes effectively with equipment that's more like $400. So using technology to lower the cost of monitors, so a single doctor can monitor a large number of people, and with telemedicine, monitor it remotely. I think we mentioned before, the connectivity is critical to these emerging nations. It's particularly critical here because that's the way a doctor that's centrally located can view, interact, or work with patients that are hundreds of miles away. We're using drone technology to do a point-to-point delivery of medicine. It's a bit safer, as you know, in some of these regions. Delivery by land can be problematic because you have roving bands of militants that will pirate the shipment, kidnap individuals that are moving it, and take and resell the drugs. So being able to at least get the shipment out and up into the air, where it's much harder to intercept, makes a lot of sense. But in a lot of areas, it's and I think I mentioned this before, you've got core issues like clean water, access to food, that are just as critical, if not even more critical than the medical problems that these people have that aren't being addressed. And I think a real problem with prioritization in some of the nations in terms of putting their resources to fix one problem and then moving to the next, as opposed to trying to fix all things at once and not having enough resources to fix anything. So a lot of it has to do with focus, but the technologies that are being applied are out there. Almost everything, though, does hinge on connectivity. If you can't fix the connectivity problem, you really can't do telemedicine well. It does require relatively high bandwidth to do right. You can deploy sensors, but once again, if those sensors can't connect back to anything, then then your centralized resources can't do you much good. And of course, finally, if you can't secure stuff and make sure it doesn't get stolen or dismantled or destroyed, all of which is happening in a number of these regions, then even if you put it in, you can't sustain it and keep it working. And so really the security of the nation, the data delivery of the nation really has to come first, because if you can't secure the equipment that's going in, and if you can't provide broadband coverage, then much of the technology you might want to provide just simply won't function, and you can't protect it even if you put it in place.
Thank you, Professor. Professor David Smith.
Rob is always right on so many of these issues. But one of the things that I'd like to throw on the table is that in the United States, we begin to transition the majority of healthcare from a model that was called fee-for-service to a model that's called value-based medicine or quality-based medicine. And this really changes the paradigm as you look at the importance of information systems in healthcare. My team has been on committees that help develop something called the Fast Healthcare Interoperable Records Standard, or FHIR. And it's something that Health and Human Services and CMS in the United States have now mandated as a standard into the healthcare industry, with the majority of the companies having to be on it by the end of 2022 now. It's been stretched out a year. And what FHIR does for you is it sets up a common data model and common API application programming interfaces that all apps can use, that calls within the apps do, and it pulls the information into a standardized data model that can work across multiple database types and other information systems. That is going to be a real important part for any nation, is to get away from proprietary data schemes and move into a standard like Fast Healthcare Interoperable Records, if they want to have interoperability between the different hospitals, the clinics, the providers, the payers, and the government. I do want to jump into something Don talked about, though, and that is access to de-identified records. In healthcare, there's a security standard called high trust certification. And what high trust certification is, the HIPAA standards we talked about before. It's PCI for the payment industry on it. It's NIST security certification it's an ISO security certification, all added together. And you have to pass all of those in a very extensive audit to be high trust certified. But Don, a real important part of what FIRE has done and what particularly high trust certification has done is it requires, for example, the hospital information systems and the EHR systems to have built into it a de-identification function so that those records could be made available for research. And Health and Human Services actually requires them to de-identify records and send into a repository there so that they can do research like at National Institute of Health and others. So part of what you were talking about, Don, is in existence, and not all systems are tapped for that because the quality of information in many is not there yet because of the people cultural difference with using the systems. But that de-identification of information is there. What's going to enhance it even better is something both I mentioned, Rob mentioned, is as we begin to put more of the Internet of Things to it, the Internet of Devices, the augmented Internet of Devices, uh, you're going to see the amount of data that's available to treat the patient, the amount of data that's available for research, the amount of data that's available to help set public policy in healthcare will dramatically go up. And you can understand a lot of the differences. Um, I was on the innovation committee at National Cancer Institute and NIH. And one of the things that really struck me is if I go into some of these records and look at treatment options, a treatment plan and a diagnosis in Maine is different than diagnosis information in Texas, which has different elements than in California. Why? The food we eat's different. Our environment is different around us. The pollutants we have around us, the makeup of the community as we look at the different types of citizens is different. The nationalities are different, which cause different things. So the use of ICT in healthcare helps us realize those differences more. And kind of to Don's point earlier in talking about Watson, is that you can begin to get the nuances of it and handle them. But then you've got to take and apply it with your local knowledge and your local patient's knowledge. You know, have I done international travel recently? Have I done some of those other elements? And that has to really flow back into it. The final thing in this one, Sharif, that I think countries need to understand, and this is at both the regulatory level, the commercial level with the doctors, the clinics, the others, at the education level, and even at the consumer level, is there is a need to put platforms in place. And what do I mean by that? Let me just share one quick graphic that I think makes it really easy to understand. And let me see if I can get that one up now. This
Yes.
is
You
a
know, that's something no one ever really thinks about, how different areas will have different levels of pollution that could affect their medical. That's really interesting. Sorry.
oh, it really is very different. Can you see the graphic I have up now?
Yes.
So this kind of gives you an idea of the healthcare arena today. And that cloud in the middle is where platforms come to play. Because if I look on the top, I'm connecting the family, the healthcare, the doctors, the patients, specialists, governments, and something called the community of care. And you notice on both sides of it, you have a public health and a social media and web bracket there. They have to play. Across the bottom, you have the smartphone based sensors, remote medical devices, laboratories, doctors, hospitals, and insurance companies. But they all have to come together. So what a platform does is let the disparate types of apps like you see above the cloud connect to the information systems in the back and even have embedded services in it. The platform that I helped develop and that is sold by a company called Biodat AI is designed really to connect those pieces together and pull that information out in a way that lets applications being written faster, because you don't have to do all the translation to FHIR, to the prescribing standards, to HL7 and others like that. It has common services, so as a developer, you write to the APIs or to the system APIs. You don't have to put it on, and it has security and other elements built into it. So it gets some of that security community that Rob was talking about in the opening comments. And you have to do those types of things to really make the use of data through ICT pervasive across the country. And that's really what you have to do to see the full benefits of ICT in healthcare. And ICT is not just for the medical part. It's used for the social part. It's used actually for scheduling nurses as part of the ICT system to come and provide you. It's going out and finding and accessing the right specialist. So there's many, many other elements of it. But the public health part, which is what I think Dan was talking much more about, is an important part. And increasingly in the last decade, at least in the United States, they've built into the policies and regulations that important role too, as you look at the information systems that are used in healthcare.
Thank you. I just want to share one of our friends' invitations, because we get audience from different part of the world. I think my friend actually from Egypt, he want to invite all of you in her conference in Egypt. I think definitely it will be in online. So I just, if you allow me just 1 minute, I just want to share. Just they are observing our show, so that's why they request that if we want to attend in this conference, we can join. And it's this is Muhammad Hashim, President of National Research Center, hosted by Egyptian Foundation of Microbiome Science and its Applications. So they want to arrange, and just they are requesting that if we share our. So thank you, Professor Fatma, to share the invitations. And definitely I believe that our speakers and our audience, those who have time to join in your session, definitely they will join, and I will share the invitation with our honorable speakers. So thank you. Actually, we have audience from different developing nations, so they have different critical problems, and we can collaborate and we can find out solutions. And thank you, Professor Donald, David, for your excellent contribution for the discussion. Mr. Dan, how do you want to add some point, especially where we discuss about some process and some technology for solving this problem?
Yeah, I think you can't talk about health without talking about causes of death on a global comprehensive scale. And the World Health Organization aggregates a lot of statistics on this subject. And it turns out the leading cause of death globally is ischemic heart disease. And one thing that could save a lot of lives is the availability of what are called external automated defibrillators. Most airports will have what's called a public external automated defibrillator. It's very easy to use. If you take a CPR class from the Red Cross, they will talk about how to use that. One thing that could be done is these could be dispatched with drones to within, because really the sooner you get to a person who's suffering a cardiac arrest event, the better their chances are for not dying. and it's really, I mean, there's the golden hour that first responders talk about. If you don't get someone into a care situation within the first hour of an adverse event, their survival probabilities go way down. But that's a topic for information in healthcare, especially GIS, the geospatial geographic information systems. That's a layer of the why of where that is going to cause huge life saving if it's deployed more. And even things like there's a technology called Shot Spotter, where you have microphones in an urban area, and if there's a gunshot sound, it can instantly triangulate on the source of that gunshot, and people could be dispatched. The appropriate people could be dispatched to save lives there. 1/3 of the world is under water stress. There are people, and that's responsible for huge amounts of deaths. Bad water access. People are dying of diarrhea, dehydration. One of my favorite ways to solve that is atmospheric water capture. People can generate clean, drinkable water out of the air wherever they need it. The clouds that you see in the sky are only 20% of the atmospheric moisture. 80% of it is invisible, and it's available to be captured. And there's actually a system that just uses powder. It's a metallic powder that saturates with water, and then you put it out in the sun, and the sun evaporates the water in a closed chamber. So that's a great low cost technology that doesn't require grid power to run. So, and then I know in the first world we have a huge problem with obesity and poor diet and being overly sedentary. Get up out of your chair every 20 minutes and just stand up for 3 minutes. That's as dangerous as smoking a pack of cigarettes if you don't do that. And then I don't know why we're allowed to have advertised all these foods that have high fructose corn syrup in them and genetically modified ingredients. I mean, it's really the same problem with like cigarettes. We had to ban cigarette advertising and put warning labels on cigarettes, but really the health impacts from bad diet are probably just as great or greater than things like cigarette smoking. So those are all information related impacts on healthcare that need to be brought into the public discussion. And I guess that's an overlap between health and public safety, but I think there is a reasonable overlap between the two fields.
Mm-hmm. Thank you, Mr. Nicholas.
David, I was curious more about the platforms, specifically all the apps. Those are patient and doctor related apps, correct?
Mm-hmm. Mm-hmm. Unmute, please.
Microphone, David.
Yeah, and hospital apps and pharmacy apps and billing apps, but they all go on.
And they have to.
So kind of think of a
they're
platform.
choosing.
Kind of think
Yes,
of a platform like iOS.
It's a volunteer thing. It's a volunteer. They download the app, they sign up, they put their email in, correct?
Well, not necessarily that way. I mean, many of these apps are paid apps.
Mm-hmm.
So
Okay.
for example, there's apps that are involved now to help doctors and hospitals meet the value-based, the quality-based mandates. And companies sell those. And one of the ways you get that is because what a quality-based app says is doctors get more money, hospitals get more money if they keep you well. Yeah. And so the quality-based apps are doing that, so it goes that way. Where the fee-for-service is kind of an interesting dichotomy. Doctors are paid to treat you, but they don't make any more money once you go all the way well. So quality-based in there is to incentivize them to do things like medication checks, to manage your blood pressure, to manage diabetes, to have you do different type of tests like colorectal scanning, mammograms, and stuff like that to enhance the ability to keep you well. But because that I have to interface across a wide variety of systems to do that. So it's not just like documenting your doctor's visit when you're there or documenting your stay in the hospital. And these go beyond it, including surveys are a part of the quality-based metrics as well. So you have to have the ability when a patient leaves to answer survey questions. Did the nurse explain it to you? Did the doctor explain it to you? So
as you
all
were
of those
explaining it, as you were explaining it, and as you were explaining it, I was just thinking about how can health insurance come into that picture, and I was thinking incentive programs. You know, the more they participate in these apps, the more they participate on the platforms, the more they actually invest in their own health. Their deductible should be lower, I think.
Well,
I think they should be.
Nicholas, at least in the United States, since companies pay the majority of the premiums, that is built into the premiums that the companies pay, is getting their employees to participate in these types of programs.
Oh, that's great. Well, that's progressive. That's definitely a progressive system. And that's something I is very foreign to my time here in Asia. It's definitely interesting to see to hear those type of things and being developed. As far as technology, and as I said, there should be more bipartisan trading of information with medical records between countries. A lot of issues, like I spent a lot of time in the Philippines, who are the #1 exporters of nurses to North America, and they don't get to really keep their nurses. But a lot of pharmacists stay behind because the government supplements their salaries because they need pharmacists so much that the government's willing to spend money to keep them here on top of their corporation's salary, their company's salary. I guess that's something they should also try to do for doctors. And also maybe more people with IT experience to help these pharmacists be more than just pharmacists, but get connected with telecommunication doctors, as you were describing, so that they could be far away, but then go pick up their medical supplies from a pharmacy with the doctor's prescriptions, or even the IV bags or anything they need, so they could try to treat themselves without having to go to a hospital and increasing their cost. Because cost is probably the biggest problem. And the technologies sound great, but I have been living in these developing nations for a long time now. It's really beyond what some people can make. Average salary where I am right now is about $900 a month, and it gets them by. But going and spending too much on medical, they would rather just be sick sometimes. So another thing that's interesting at these hospitals is they choose to give them more traditional medicines, like roots and berry type medicines. And this will be the first medication to receive. If they don't work, they will upgrade you to the more strong pharmaceuticals. So that could also be another way to cut costs in a lot of other developing nations. Offer the more natural medicines at first, and then if it's a persistent issue, upgrade to stronger pharmaceuticals. I mean, in America, we took opium and made opioids, and that's perfectly legal, but you can't use just plain opium. And why not just do the same thing for marijuana and hemp, make a more condensed CBD or THC type prescriptions and give those to people, and don't call it marijuana, call it cannabinoids. And there's just so many things we could do between changing the system for cost and for the employees and doctors and pharmacists. Okay, thank you.
Yeah, thank you. This is really, really great discussions, and I'm sure that this kind of services and technology will be very helpful for the developing nations. But I want to add some point because we are discussing on healthcare insurance, many things. I'm from Bangladesh. We have 160 million people, even more than that. Small country, many populations. Uh, but can you imagine they do not have even healthcare insurance? We do not have. In Bangladesh, I know many countries in developing nations they do not have health insurance properly, and for that issues, many people actually suffer. Many people actually suffer, even when they had to go for the expensive treatment and many things. I know even the COVID treatment is very expensive. Uh, but we are discussing how we can utilizing proper healthcare system. But in the developing nations, even there are some countries still they do not have health insurance. I do not know how I explain the total system and approach and everything, but problem is massive. So we have to solve it. We have to work together. We have to convince governments. So this is dangerous. Even my family actually suffer. Even the when my father died last time, I cannot arrange a intensive care unit because of these complexities and other things. So this is the reality. This is the reality. The world is so big. There are different complex problem we have. Yes, I know there are many good people, there are many good organizations, many good models, but that is our objective. We want to convince our government, we want to convince our corporation that you need to apply this kind of good technology. So that's why World Talent Economy Forum very open. Any good idea and applications, at least we are open. We have many young populations, so we will definitely try to convince our government and the corporation you should apply these things, because sufferings is so big, we cannot handle these things. Thank you. I directly want to go for the concluding remark. This is really, really valuable discussions. So we are open
Sharif,
for
really
any.
fast. Are you saying corporations should offer health insurance to their employees? Is that what you're saying?
Definitely. Example, I know many big corporations, they have hospitals, they have university, they have 50,000 employees, but they do not provide healthcare support to their employees properly. So things are definitely complicated. I'm from the industries and from the developing nations, so that's why I can understand more what's going on. So I'm just giving you one example of Bangladesh. So in the healthcare industry, every country actually right now suffering, and we have to work hard. We need to work together. So definitely corporate has to provide services to their employees for their healthcare issues, and they have ability. Trust me, money wise, developing nations do not have problem is proper system, proper institutions. So that is the objective we have. We can develop, helps to develop better institutions. uh, so that is one of the aspect. Maybe we will discuss later, but today we just focus on technology, and I directly want to go for the ICT, sorry, the concluding remarks for today. But one of our friend from Egypt, she is trying to join, but somehow she cannot. I'm sorry about Professor Fatima. She want to join with us because she is observing our show and she is very interested to share her conference information. Already we share the informations. So what the concluding remarks today, Professor Rob?
Well, like most of the things that we talk about here, the advice is first create a set of priorities. What is it you need to fix? And then you apply the solutions that are available to you to those priorities, fixing the first thing, moving to the second. When we're talking about healthcare, we probably should always start off with a ranking. Who does it best, and what is it they do to make it best? France continues to rank as number one in world ranking for healthcare. The United States isn't a good example. We tend to rank way back in the pack in terms of healthcare. A lot of it has to do with the fact that we don't seem to be able to address cost, and the pharmaceutical industry carries way too much sway in terms of how things are done here. And so you were talking, Sharif, about the fact that you don't have healthcare. In this country, many people can't afford it, can't afford the health insurance or the healthcare. And and that's certainly unfortunate. So using examples for the people that from the countries that do it best, and then applying those examples to the problems you have can also help you solve some of these problems. But I would start with prioritization. I'd also suggest that a lot of the problems that we have with regard to healthcare are information based. And if you can't connect people to information, you can't solve those problems. So connectivity forms kind of the core of solving most of the technological problems, or at least provides the core of using technology to solve the problems regardless of the industry. And if you can't connect people, then right now, in many cases, technology may not be your first answer. You may have to fall back on an older process that doesn't require connectivity, doesn't require power to solve the problem. And then final comment, misinformation is a huge problem in this particular segment. In particular, I recall that Steve Jobs largely died because he had pancreatic cancer. He was provided with misinformation about using holistic methods. And had he just simply followed normal procedures, it was identified early enough for him. But he was so concerned about things like chemical approaches to solving cancer that he tried everything else, and he died, and clearly regretted the end. And before he died, indicated that his process was flawed. People need to get not only access to information, but that information they get access to has to be accurate, because misinformation can kill you just as quickly as no information. So connectivity, veracity of information, and a prioritization of the problems can solve these things. Just talking about them or just throwing money at them doesn't.
Mm-hmm. Thank you, Professor Rob. Professor David Smith.
The use of ITC in medicine, in healthcare, in health public policy is going to allow us to begin to move faster, to look at policies and things better, and to actually change the way the medicine education is done. One of the benefits of COVID is it's opened the door to let paradigm changes move faster. The year before COVID hit, the use of telemedicine, the use of telehealth was pretty low. It's become common today everywhere. And you've seen that, and COVID is to exchange. In the medical schools, they recognize the changes brought on by the use of ICT technology, particularly how it was used in COVID. Very, very interesting in that many medical schools today are now requiring medical students to write programs as part of their MD degree, and to understand population health and how to spot the trends as part of their MD degree. So ICT has dramatically gone back and changed how we're doing it, and the use of the digital infrastructure in place around COVID has really accelerated the ability to do that. And it's very interesting, though. So the big other difference I kind of like to talk about before we leave in this conclusion is that we think about the pure medicine part of it. There's a very important part when you look at the medical staff. Back a couple of decades ago, in some of the work we were doing with Johns Hopkins, there was turnover in the intensive care units and the intensive surgery care units, and nurses. It was real interesting in talking with the nurses. The reason they had that stress was they had some of the sickest patients around, but because the doctors were both treating patients, but also doing research, but also teaching future medical doctors, most of their interaction with the nurses was over the telephone. And there was this disconnect because the nurses would say, doctors have gotten so good about talking without any emotion in their voice. We don't know what's really going on in the patients unless we see the body language. So we added webcams to go between the doctor's research lab and the ICU, and the retention rates went up. So we can use this technology in ways outside of just purely delivering healthcare to the patients. And that's really important as we look at ICT spread. And particularly as you think of it as a public policy portion, like we have begun here in the United States with a transition for fee-for-services to fee-for-value. If I'm a developing country, I really want to be more in the fee-for-value, the fee-for-quality. Yes, you're going to have accidents, and you're still going to have to treat them as a fee-for-service. But I'd rather them be paid to keep me well than to be paid to keep me a little sick. So that's kind of my concluding remarks.
Thank you, Professor. Thank you, Professor. Mr. Dan.
There's a saying among investigative journalists, cui bono, follow the money, and who is benefiting. And if we don't incentivize doctors keeping people well, I mean, if they're actually going to make more money by keeping someone in a sick condition and they can continue to treat them, that's got to be looked at. And another thing that really needs to be reformed is the state of medical education. There is virtually no nutritional information offered in the traditional medical schools, and even the mainstream medical journals recognize that this is a problem, but it's not changing very rapidly. So maybe there has to be some public pressure there. Another thing that's overlooked is the extinction rate of biodiversity. We are losing plants of potentially amazing medical significance that once they're gone from the biosphere, they're gone forever. I think there's an estimate that we're losing, like with the current rate of extinction and loss of biodiversity, we're losing about 2 really important potential drugs every year that we'll never see because of the way the rainforests are being chopped down to make cow grazing and canola oil plantations. So it's like we're making unhealthy food and killing these exotic biodiverse potential medicinal plants. So I just want to thank you again for the opportunity to present. I think this is a huge part of the indefinite longevity platform of the transhumanists, and the public needs to be better informed on this, and I'm going to be talking about it in my local city council candidacy. So thanks again.
Thank you, Mr. Nicholas.
Got to sneak that little bit of politician work in there, huh, Dan? Well, I'll end on an educational note, I guess. Myself, I tiptoed around the technology talk a lot because I really don't know that much about programming, software, and that's probably the most crucial element of this discussion that Rob and David are our experts on. And this is something I want to be a tiger parent about with my own child. Just like a lot of parents are like, oh, you got to get straight A's in math and science. I want my kid just, if you know nothing else, you're going to know how to program and software and some coding, because that is the future. Medical, as David said, the medical students have to know how to program now. Everyone needs to know how to program in this next generation. They all get, if you don't know, you will be left behind. You will be the essential, the maintenance workers, you will be. And if you want to be any elevation from just an everyday person, which isn't bad, we need plumbers, we need technicians, we need electricians, but even electricians are going to end up programming eventually. Even plumbers are going to end up knowing how to run the computer that automates the plumbing in a home. So this is just so essential for the future that if you, like me, only kind of understood maybe 60% of some of the things that Rob and David were talking about, that's something that you should focus for your kids and younger people in your families to make sure that they understand what ICT is, what IT is, what IS means, what these acronyms mean about information and technology. It's so essential. Thank you.
Thank you, everyone. This is really great discussions, and uh, uh, we know actually because I'm emotional because for the healthcare industry, how the developing nations suffering. I get even that kind of call in between 7 days. My money will be finished, and I cannot like take care of my brother because my friend brother right now in intensive care unit, and it's a very expensive. And it's very funny that our government, our politicians, our corporation, nobody care about healthcare insurance. So many things happening around the world, but we need to connect all of the good peoples and the good technologies and all of the good opportunities. So Professor David Smith, Professor Robs, even Dan, and Mr. Nicholas, if you have some good idea, good technology to share with our government and corporations, we are ready to do that. It's not all about business. It's about we have to save human lives. We have to save human lives. Many every day, thousand and thousand people actually dying. They are affecting for the COVID situation is very bad. We need to work hard. Maybe every country's individual capacity is not enough. We need to work together as a global community, and that's why we create this World Talent Economy Forum. Any of your good idea and your service or your technology, we are happy to introduce to the developing nations. Maybe we can save more human lives. Maybe they can get better treatment. Maybe they can get better education. So we are open for that. Thank you, Professor Rob, Professor David Smith, Mr. Dans, Mr. Nicholas, for your continuous support for World Talent Economy Forum. Bye-bye and take care. Bye.
Have a good day. Have a good night.
Have a great one.
Bye. Bye.